Hi, my name is Cafrey and I'll be talking about Otezla. Some of the patient consultation points. Side effects may include headache, upper respiratory infection, nasopharyngitis, abdominal pain, dyspepsia, decreased appetite, and fatigue. We want to instruct patients to report any new or worsening depression, suicidal ideation, or unusual changes in behavior. Recommend patient report severe diarrhea, nausea, or vomiting. And lastly, we want to tell patients to report on intentional clinically significant weight loss. Some of the introduction points. Otezla was FDA approved in March 2014 and was developed by Amgen Incorporated. It was first approved for treatment of psoriatic arthritis. As of right now, there is no generic version until Otezla patent protection expires on 2028. Amgen brought in a revenue of $2.29 billion in the year of 2022, and part of that, US sales were about $1.89 billion in the year of 2022. Mechanism of action. Apremilast is an oral small molecular inhibitor of phosphodiesterase 4, specific for cyclic adenosine monophosphate. PDE4 inhibition results in increased intracellular count levels, but the specific mechanism by which apremilast exerts its therapeutic action is not actually well defined. Indications. As of right now, there's 3 indications that have been FDA approved. The first one is active psoriatic arthritis. The second one is plaque psoriasis, in which patient has to be candidate for phototherapy or systemic therapy. And the third one is Behçet syndrome, which is the ulcer of the mouth. Dosages. For the 3 FDA-approved indications, there's 2 different sets of dosages that we need to keep in account. The first one, which is the normal renal function, which the clearance is more than 30 mL per minute. Day 1 is 10 milligrams in the morning. Day 2 is 10 milligrams in the morning and 10 milligrams in the evening. Day 3 is 10 milligrams in the morning and 20 milligrams in the evening. Day 4 is 20 milligrams in the morning and 20 milligrams in the evening. Day 5 is 20 milligrams in the morning and then 30 milligrams in the evening. And day 6 and thereafter is 30 milligrams twice daily. Now, the second part, which is the severe renal impairment, which is the patient has clearance of less than 30 mL per minute. Basically, day 1 is 10 milligrams in the morning. Day 2 is 10 milligrams in the morning. Day 3 is 10 milligrams in the morning. Day 4 is 20 milligrams in the morning. Day 5 is 20 milligrams in the morning. And day 6 and thereafter is 30 milligrams once daily. Contraindication. There's only one, which is hypersensitivity to apremilast or any components of the product. Adverse events. There's 5 adverse events that need to look for. The first one is hypersensitivity. Second is diarrhea, nausea, and vomiting. Third one is depression. Fourth one is weight decrease. And last but not least, upper respiratory tract infection. Drug interaction. There's only one drug interaction that we need to be careful with, which is the strong CYP450 inducer. Those include carbamazepine, glycyrrhizin, phenobarbital, phenytoin, rifampin, St. John's wort.